Everyone. In this lecture, I'm going to discuss the pharmacognosy of onions, one of the oldest cultivated plants in the whole world that were probably known in China, India, and the Middle East before the recorded history. Ancient Egyptians regarded the spherical bulbs of onion as a symbol of the universe. This lecture is for PharmD third semester students presented by me, Dr. Shaima Abdul Gawad, Lecturer of Pharmacognosy, Faculty of Pharmacy, Fayoum University in Egypt. Onion or common onion or garden onions, known also in Latin as Bulbus aliciba or in Arabic as al-basal. In this lecture, I'm going to discuss the following topics: botanical and geographical origin, morphology and microscopy, active constituents, chemical tests for identification of those constituents, uses, dosage, side effects, contraindications, drug interactions, and available products in the Egyptian market. Now we will start with the botanical origin of onion. Onion is a ripe bulb of Allium cepa belonging to family Amaryllidaceae. The geographical origin. Onions used historically in China, Egypt, Iran, Pakistan, and nowadays is cultivated and used worldwide. To discover morphological and microscopical features. At the first, the morphology. Onion bulbs, and when I'm saying bulbs, it means it's type of subterranean stem, not subterranean root. It composed of shortened, compressed underground stem. Actually, this part only, the compressed part here, rigid part, that we are cutting and rejecting from the onions. This is actually the subterranean stem, shortened and swollen disc. Which is surrounded by fleshy modified scaly leaves. The part we are actually eating from the onions is a fleshy scaly leaves that envelop a central bud at the tip of them. The rigid part inside the center of the onion is actually the bud. So this tonicated bulb composed of the shortened swollen stem with its adventitious roots and the bud in the center of the onion bulb, surrounded by scaly leaves enveloping each others. So this is a type of subterranean stem known as a tonicated bulb. They are pungent when chopped and contain certain chemical substances that may irritate the eyes. We all know the onion tears. So at the part of active constituent on the later slides, we will discuss why we cry or have tears when chopping the onion and how could we avoid this. About the microscopy, there are only few data available about the microscopical examination of onion bulb. The most important of those data that the epidermis of onions scaly leaves showing a very big nucleus could appear under microscopical examination, as you can see here in this picture. Now we are going to discuss the active constituents present in the onions. Onion is very rich source for the organosulfurous compounds, and the major compounds identified as onionine A. This is a cyclic organosulfurous compound, and cycloalline also from the cysteine sulfoxides. We have cycloalline, isoalline, methionine, and propionine. All are organosulfurous compounds. Some are cyclic and some are not cyclic or in a straight chain. Also, onions is a very rich source for the phenolic compounds, especially the flavonoids known as rutin, quercetin, and quercetin glucosides. Quercetin is a major compound in the skin of red onion, while quercetin 4-glucoside is the main compound in its pulp. Those are the structure of major flavonoids in onion. And the most important is quercetin and quercetin 4 prime glucoside. They are the major compounds present either in the onion skin or the onion pulp. Also, onion is a very rich source of phytoestrogen such as cholesterol, zearalenol, isoflavones, and humulone. These phytoestrogen make the onion is a suitable food for the postmenopausal women to compensate the decrease in their estrogens and avoid diseases such as osteoporosis. Also, onions is a very have another constituents such as volatile oil, polysaccharides, which are also important for onions' pharmacological activities, as we will discuss later, such as inulin, fructooligosaccharides, galactose, glucose, and mannose. It has a simple sugars, and these simple sugars are the reason for which when we fry onion, it caramelizes, giving the brown color and also the sweet taste of caramelized onions. It contains also saponins and anthocyanins, which are especially present in the red onion than the yellow onion. Yellow onion. Effect of cooking on the active constituents. The bioavailability of phenolic compounds, especially quercetin derivatives, were found to increase by cooking, such as baking, grilling, or frying. On the other side, we will see the effect of cooking on the sulfur compound, organosulfurous compound, especially the cysteine sulfoxides. They are changed differently in onion heating processing depending on the cooking methods. For instance, their contents were decreased during boiling, but it increased during frying, microwaving, and steaming. So when you are, for example, making a chicken or meat broth, when you add the onions, you use a boiling method to prepare that soup. So this method will decrease the content of organosulfurous compound. Instead, to keep the organosulfurous compound in high percentage, you can use it as raw, or if you want to cook it, you can use frying, microwaving, or steaming to preserve their organosulfurous compounds or their concentrations. Chemical tests. Actually, this test is used in the food industry to make sure from the quality of the used onion powder or onion plant in several food uh, products. It known as onion pungency test or Squamer and Western test. It's a very old test known since 1960s. The onion tissues produce distinctive volatile sulfur compounds when the cells are damaged mechanically. We previously mentioned a compound known as isoalline. This compound, with the action of enzyme known as allinase present inside the onion pulp, converted to thipropanol S oxide and pyruvic acid and ammonia. The thipropanol S oxide, which is the tear-causing factor, that compound which make us tear upon the chopping of onion. It also furtherly degraded to form mono-di and trisulfides. So to avoid tearing while chopping the onion, uh, actually several steps could be performed. You can uh, cool the onion before cutting it, because as you know, this is a volatile sulfur compound, so cooling may decrease the volatility of those compounds. Also, another technique is to dip your knife inside an oil before chopping the onion. The oil on the knife will prevent the action of allinase enzyme, which need moisture to work properly to convert isoalline to thipropanol S oxide. So those are the major two techniques to decrease tearing while chopping the onion. Here we also make use from the produced pyruvic acid for the quality control testing of the onion pulp or onion powder. A good onion which contain a good amount of isoalene and other organosulfurous compounds. So here in this reaction, one isoalene molecule produce one pyruvic acid molecule, and the quantity of pyruvic acid is will be equivalent to the amount of isoalene. Two scientists named Squimmer and Weston developed a method for qualifying the onion powder or onion pulp according to their isoalene and the produced pyruvic acid quantity. In this method, the produced pyruvic acid react with 2 and 4-dinitrophenylhydrazine in the presence of sodium or potassium hydroxide and produced a color that is measured. The color concentration is proportional to the amount of pyruvic acid and subsequently to the amount of isoalene. The concentration or absorbance of this color is measured at lambda max of 420 nanometer using the spectrophotometer. Uses of onions. In this lecture, we are going to discuss a very important and several medical application for the onion as a food or herbal supplement. Onion has a very important role as a chemoprotective or anti-cancer effect due to its organosulfurous compound and selenium. Studies suggest that the higher intake of onion is associated with lower risk of breast, brain, gastric, prostate, lung, colorectal, and ovarian cancer. There are several reported mechanisms for the usefulness of onion in the either as a protective from several cancers or either in as a supportive treatment and treatment strategies for cancer patients. It prevents DNA damage and mutational changes, increases the bioavailability of anti-cancer drugs, improves the response of cancer cells to chemotherapeutic agents. It also induces phase 2 detoxificating enzymes, as well as it induces the apoptosis and control cell proliferation and tumor growth. Yeah, onions as well is very known for its antidiabetic effect due to organosulfurous compounds and quercetin. It stimulates the production and secretion of insulin, interfering with the dietary glucose absorption and favoring insulin saving. Onions also modulate the activity of enzymes which are incorporated in the metabolism of glucose or carbohydrates such as alpha glucosidase, hexokinase, glucose 6-phosphatase, and HMGA coenzyme A reductase. The later HMG-CoA enzyme reductase is also important in the metabolism or synthesis of cholesterol. So onion here could play several mechanisms to reduce the blood glucose level and exhibit the antidiabetic effect. Additionally, onions has a fibrinolytic properties due to its also organosulfurous compound and quercetin. The administration of onion increases the coagulation time and fibrinolytic activity as it inhibits the production of thromboxane A2. This is the precursor of fibrin, which form the clot and preventing thrombus growth and also promote the fibrinolysis. Onions additionally has anti-obesity effect due to quercetin content. In this part, I'm talking about not the onion leaves or bulbs that we eat, but about its skin or peel, which is a very rich source of quercetin. So here, onion could provide a cheap and home extract for quercetin. Quercetin has a very important role in the treatment of obesity. It is able to suppress the pre-adipocyte differentiation and also inhibit adipogenesis. So could it prove a good supplement for the obese patients. Onion has a cardioprotective effect. This is due to its organosulfurous compounds and quercetin. It decreases the elevated blood pressure, cardiac hypertrophy and atherosclerosis, and also, as we previously discussed, it inhibits enzymes such as HMG-CoA reductase, and so on. It can reduce the serum low density lipoprotein, cholesterols and triglycerides, and exhibit hypolipidemic or anti-hypercholesterolemic effects. Onions as well have antimicrobial activity due to quercetin and quercetin glucosides. Flavonoids are very important class of secondary metabolite acting as antimicrobial. This is very known for all researchers in natural product field. Onions possesses a potent antibacterial, antifungal, as well as antiviral effects. It could be used as a natural preservative in the food industry, such as maintaining meat quality during refrigerated storage. So it's preferable when you are going to store meat or chicken, for example, at your refrigerator, to add some onions with it, which could let them preserve it for longer times due to its antimicrobial activities. Onions as well is very important for its bone protective effects due to its organosulfurous compounds and the phytoestrogen we previously mentioned as the part of active constituents. Also for the quercetin and the vitamins such as vitamin K and C. Onions has a protective effect on the bone, and it might be essentially valuable for menopausal women who are at risk of osteoporosis. The mechanism of this action is due to inhibiting the activation and formation of osteoclast precursor cells, inhibiting bone desorption, and increase the bone mineral content. Actually, these two mechanisms mainly due to the presence of phytoestrogen. The presence of potassium also is very important. It works synergistically with the calcium. So you can found in most supplement containing calcium, they contain also, or vitamin D, they contain also potassium, because potassium help in the deposition of calcium inside the bones. So onion here could provide several compounds important for the health of your skeletal system. The onions also have a very important role on the gastrointestinal tract due to its high soluble fiber content, including inulin, and also due to the presence of polysaccharides such as fructooligosaccharides and quercetin. Onions could stimulate the growth of useful microorganisms such as bifidobacteria and lactobacilli in the colon. These are the natural probiotics we have in our colon, and they are very important for the whole health of your body. They are important for your mood, for your immunity, so enhancing their growth in the normal level will subsequently affecting your overall health. So onion here is very important as support for the natural prebiotics we have. Onions administration for 28 successive days restored the activity of liver enzymes such as aspartate aminotransferase AST, alanine transaminase ALT, and lactate dehydrogenase LDH enzymes to their normal levels, and reduced also the plasma bilirubin. So could be helpful for liver patients or patients have jaundice. Additionally, it has antispasmodic and antidiarrheal activities, help in the treatment of diarrhea due to its antispasmodic, also for their antimicrobial effect. The most interesting in this slide that it could help patients with peptic ulcer due to Helicobacter pylori infection, because onions work with its antimicrobial effect against the Helicobacter pylori, this the bacteria causing peptic ulcer. It also promotes the mucus secretion in the stomach, which help in protecting the lining of the stomach from the effect of gastric acid. So it works in two different mechanisms against the peptic ulcer. Treatment of the root cause of the peptic ulcer, which is Helicobacter pylori infection, and also treating the symptoms or the reason of the pain, which is the mucus lining. So it's very effective here. Moreover, onions has effect also in the center on the central nervous system due to its quercetin and quercetin glycoside. The onion supplementation may be helpful in the treatment of anxiety and depression. It can cause improvement in the following cases: behavioral defects, motor incoordination, and short-term memory. Onions as well has an important effect in the respiratory system due to its organosulfurous compounds and quercetin. It has antioxidant and immunomodulatory properties. Onion extract can attenuate the pathological effect of nicotine in lung, so could be helpful for the nicotine smokers. It also used in the treatment of allergic rhinitis due to its antihistaminic effect, and this could explain why we feel sleepy after eating large quantity of onions. This is due to its antihistaminic effects. Onions also exhibited a bronchodilator effect, which is beneficial for the treatment of obstructive pulmonary diseases. It can also protect from bronchial asthma. The mechanism of onion as anti-asthmatic supplement depend on that onion relaxes the tracheal smooth muscle or has antispasmodic effect. Onions also decrease the lung inflammation and the neutrophil, eosinophil, and lymphocyte count. It reduces the production of inflammatory cytokines such as interleukin 5 and interleukin 13. It also reduces the protein oxidation in bronchoalveolar lavage fluids, so very beneficial for patients suffering from allergic rhinitis or cough or bronchial asthma. On the urogenital system, onions have important effect due to its quercetin content and quercetin derivatives. Onion has a beneficial effect on the urogenital system. It increases the libido, sperm motility, and vitality. It cause improvement of the sexual impotency and improve also prostatitis and reduce prostate cancer risk. So it is very important for men, increasing their fertility and also reduce the men-related diseases such as prostate cancer. They reduce the risk for these diseases. Also has effect on the urinary system. It works as a diuretic, mild diuretic, and this could be helpful in extracting renal stones. The plant reduces the elevated creatinine and urea levels and attenuate the renal histopathological damage. So very beneficial also for patients who have kidney diseases. Externally, onion oil used in several cosmetic preparations to stop hair falling and promote also the hair growth. Dosage: as a food you can use onion as you want. There is no dose for it as a food, but as a supplement when you are going to use, for example, onion extract. It is possibly safe to use onion extract as a medicine in a doses up to 900 milligram daily up to 12 weeks. Side effects: normally, onions and its bioactive compounds are quite safe for humans. However, several potential safety risks have raised concerns. For example, The residue of pesticides by accumulation of heavy metals and the contamination of pathogenic microorganisms. The most common infection occurred on the onion bulb is the black mold infection, known as black mold of onion, or infection by Aspergillus niger. The black mold is on onion. This is a very common food to all of us we know. This is caused by a fungi called Aspergillus niger, common fungus in the soil. To discourage the mold growth, store onion in the refrigerator up to 2 months. So if you have infected onion, what should we do with it? Rinse off the small amounts of the black mold on the outer scales of the onion under cool running tap water, or cut off the affected layers. The unaffected part can be safely used. Eating moldy onions can cause diarrhea, vomiting, nausea, headache, and stomach pain, and long use of it result in the aflatoxosis or its poisoning could result in a complete liver failure. So it's very important to avoid eating onions infected with Aspergillus niger to avoid the poisoning or aflatoxosis. Contraindications in pregnancy and breastfeeding. Onion is commonly consumed as a food safely, but there isn't enough reliable information to know if onion is safe to use in larger amount as a medicine when pregnant or breastfeeding, so should be used cautiously under medical supervision or avoided. Close allergen. People with allergy to mugwort and celery might be allergic to onion, so should use it cautiously or avoid its use. For patients are scheduled for a surgery, onion might slow blood clotting and lower blood sugar level. This might increase the risk of bleeding or interfere with blood sugar control during or after the surgical procedures. So onion supplement should be stopped at least 2 weeks before a scheduled surgery. Drug interactions. Onions have interactions with the following drugs. With aspirin, some people are allergic to onions, as we previously described in the contraindications. Aspirin might increase people's sensitivity to onions if allergic to onions. Also, the anti-diabetic drugs alongside with the onion supplement could lead to hypoglycemia, so patients receiving both anti-diabetic drugs and onion supplement should monitor daily their blood sugar level. Also, with anticoagulant, the use of anticoagulants alongside with the onion supplement could lead to bleeding problems because its fibrinolytic effect. So should be onion supplements should be avoided while you are using other anticoagulants. Examples of onion products available in Egyptian market. These are examples of onion supplement either as a capsules containing 1 gram of onion extract as a liquid tincture, or as an oils for treatment of hair problem. This is kishking. It's very popular here in Egypt for the treatment of hair fall and to stimulate hair growth. It basically contain onion oil. So also other products are available, but these are few examples of onion available products. I hope this lecture was useful to you, and if you have any question or comment, please write it down below this video. Thank you.